Welcome to the MDSS campus, with the topic Substantial Changes to the Quality Management System, Annex 9, Section 2.4. This presentation is intended to support a better understanding of the Medical Devices Regulation, MDR, and the In Vitro Diagnostic Medical Devices Regulation, IVDR.IRI. The content has been prepared by Ludger Moeller, head of the MDSS Group, with the objective of presenting the exact minimum requirements set forth under these regulations. The MDR and IVDR are already sufficiently strict. Let's adhere to the minimum requirements. The presentation is offered free of charge. We kindly encourage you to watch it in its entirety, especially the closing segment, which includes a disclaimer and a brief introduction to the services MDSS provides. For ease of listening, all references are made to the MDR. Unless stated otherwise, the same principles apply to the IVDR. Any significant deviations relevant to the IVDR will be clearly indicated. Let's dive right into the topic: understanding substantial changes under the MDR. The term substantial change appears in Annex 9, Section 2.4 of the MDR. According to this section, the manufacturer is obligated to inform the notified body of any plan for substantial changes to the quality management system or the product range covered. This requirement plays a critical role in maintaining the validity of the conformity assessment and ensuring ongoing oversight by the notified body. In this presentation, we will only address the substantial changes to the quality management system. What does substantial mean? A closer look at the obligation. There has been considerable discussion around the interpretation of the term substantial under the MDR. A wide range of views exist, often pointing out that the regulation does not explicitly define the term. As a result, it is frequently claimed that the MDR leaves room for broad interpretation. The current practice often results in the notified body being treated as the primary authority on whether a change qualifies as substantial. This is reinforced by procedural expectations in which documentation is submitted for that purpose and determinations are issued accordingly. This approach reflects a misunderstanding of the regulatory framework, which does not assign this responsibility to the notified body in such a manner. In fact, the obligation to assess whether a change is substantial lies primarily with the manufacturer. It is the manufacturer's duty to determine whether the notified body must be informed as part of the conformity assessment procedure that has been approved. The notified body's responsibility is to ensure that the approved quality management system provides for the procedures that the manufacturer informs the notified body of planned substantial changes. Then, the responsibility of the notified body starts again after it has been notified of the planned substantial change. At that point, its obligations are clearly outlined by the regulation for the notified body. Importantly, the term substantial is not used in isolation or without context. The MDR provides clear requirements on what is meant by substantial in this setting. Key references for this include Article 56, concerning the validity of the certificate and limitations. Annex 9, Section 2.4, detailing the requirement to inform the notified body. Annex 12, listing the minimum content of certificates. Annex 12 plays a critical role in identifying what should be considered substantial. It gives insight into the certified elements of the quality management system and device range, any change to which could trigger the obligation to inform the notified body. It should be outlined which information is not required to be forwarded to the notified body. The manufacturer is not obligated to inform the notified body of minor or normal changes to the approved quality management system. Those changes may be implemented without informing the notified body, and those will not trigger a supplement to the certificate. This goes along with the common understanding that the manufacturer is responsible for the application of the approved conformity assessment procedure, which allows the manufacturer to act responsibly within the approved setting. Only substantial changes need to be approved. Annex 9, Section 2.4 describes a process, not just a rule. This lays out a clear process regarding changes, particularly those that could substantially affect the quality management system. This is crucial. Again, the manufacturer is not required to inform the notified body of all changes to the quality management system. The notified body must only be informed of plans for substantial changes. If the intent of the regulation were to require notification of all changes, the MDR would have stated so explicitly. Once a plan for substantial change is identified and reported, the notified body must review the proposed change. This review, if deemed appropriate, results in an approval with a supplement to the certificate. The deeper one examines the wording of Annex 9, the more evident it becomes that it does not simply impose an obligation, it describes a process, identification of substantial changes. The manufacturer identifies via its quality management system future changes and checks whether those changes are substantially affecting the quality management system. If the changes are substantial, then the manufacturer informs the notified body of plans for substantial changes. The notified body shall assess the proposed changes and determine whether additional audits are needed. The notified body verifies that the quality management system still complies with Section 2.2 with those proposed changes implemented. The notified body shall inform the manufacturer of its decision, including assessment results and, if applicable, audit conclusions. The notified body must provide a supplement to the certificate if the changes comply with the requirements. This structure underlines that compliance in this area is about integrating a decision-making process into the manufacturer's quality management system, a defined part of the conformity assessment itself. Clarifying the debate around the term substantial. The term substantial is often subject to debate. However, when the process described in the MDR is respected, it becomes clear which changes truly qualify as substantial. Only those changes to the quality management system that have an impact on the certificate itself are to be considered substantial. This clarity is supported by Annex 12, which outlines the minimum content of the certificate. While the word minimum is used, the Annex sets forth a comprehensive list of certificate elements. Here are just a few examples of elements that are required on the certificate. When any of this change, the manufacturer is obligated to inform the notified body. For example, a change in the manufacturer's name or address. This directly affects the identification of the legal entity holding the certificate. A change in the authorized representative. If the address of the representative is listed on the certificate, any modification will also lead to a supplement to the certificate. A change in the devices or device range covered. Annex 9 clearly refers to the device range covered. Any adjustment here is highly relevant. A change in the conditions listed on the certificate. These conditions often reflect specific limitations or requirements. Only changes to those conditions may be considered significantly change and may trigger the need for a certificate supplement. Consequently, other changes to the QMS which are not outlined on the certificate are not substantial. Understanding the role of conditions or limitations and other certificate elements. Let's now take a closer look at how conditions and specific listings on the certificate may also define what constitutes a substantial change. Conditions may extend the certificate content. For instance, if the notified body determines that clinical data is insufficient, it may require post-market clinical follow-up activities. In such cases, the post-market clinical follow-up requirements are to be maybe explicitly listed on the certificate. A substantial change to the post-market clinical follow-up plan would therefore require the manufacturer to inform the notified body, as these would be considered substantial. Suppliers may also be listed. If a specific supplier is critical to the manufacturing or verification process, their identification might appear on the certificate. Any proposed change to such a supplier is a substantial change, as it may affect the certified assessment process and must be evaluated by the notified body. These examples underscore the importance of tracking what is listed on the certificate. Every element, whether it's a condition, a device group, or a critical supplier, can become the basis for determining whether a change is substantial. The debate may be, when is the approval given with the supplement certificate? The process clearly outlines that the supplement to the certificate must be given before the changes are implemented. This is substantiated with the following. The manufacturer must inform the notified body of any plan for substantial changes to the quality management system. The use of the term plan is key here. It implies that notification and assessment are required before the change is implemented. This is further supported by the subsequent obligations of the notified body to assess the proposed changes, to determine the need for additional audits, and to verify whether the quality management system continues to meet regulatory requirements after the proposed changes. Only then is the approval formalized through a supplement to the certificate. Now, the discussion could be around the additional audit. What is meant here with auditing? The audit must assess the proposed change, which have not yet been implemented. Under Annex 9, Section 2.4, the notified body, shall assess the changes proposed, so any audit must occur before the notified body issues its approval. Supplement to the certificate, which in turn must occur before implementation. How can an audit verify a change that isn't implemented yet? A real, live process can't be audited until it exists. But in this case, the audit is not assessing performance in use. Rather, it assesses whether documentation and controls are in place to implement the change as planned, whether the plan for the change is appropriately integrated into the quality management system, for example, plans to update SOPs, risk assessments, resource planning, etc. And the most important aspect, whether the planned implementation would maintain conformity to Section 2.2 of Annex 9. This is essentially an audit of readiness, not of operational history. It's a forward-looking evaluation. The notified body is checking whether the quality management system, as it will be after the change, will still comply. Only after the notified body is satisfied through its review and audit, if required, it can issue the supplement, which is the formal approval. Only then may the manufacturer implement the change. This process is quite reasonable if the notified body concludes that the planned changes do not comply with the QMS requirements. It helps avoid unnecessary work. The changes are substantial and critical. Therefore, the involvement of the notified body to approve the planned changes. The process, as outlined in the MDR, clarifies clearly that the conformity assessment is the responsibility of the manufacturer. The manufacturer is acting within the limits of the approved system. Case example: change of the authorized representative. The change of the authorized representative is an excellent example of what constitutes a substantial change. The authorized representative is considered critical. While we won't delve into the full extent of the authorized representative's pivotal role here, it is important to note that the authorized representative is explicitly listed on the certificate. Therefore, any change to the authorized representative is a substantial change. Let's dive into the process. First, the notified body examines the proposed change, verifies that the mandate with the incoming authorized representative is in place, and verifies that the elements of Section Annex 9, Section 2.2 are still being met upon the changes are being implemented, and issues a supplement to the certificate without delay. Fourth, whether additional documentation is required may depend on the manufacturer's past performance and the quality of their quality management system. The notified body may request supporting documents, or the manufacturer may provide transitional information. This documentation may include a quality management system strategy update, Article 12 draft agreement, a timeline for updating labels, and steps to ensure continued compliance during the transition. Fifth, based on the information provided, the notified body can assess the proposed change. Independent of the change, the notified body may choose for this or for any other change to verify the change upon full implementation during the next scheduled surveillance assessment, ensuring that all changes have been correctly and effectively integrated into the quality management system. Another example may be the change of address of the manufacturer. The address of the manufacturer is certainly a substantial change in any case. In case only administrative functions move to the new address, an additional audit is not indicated. In case of critical process steps are being moved, the notified body may decide to audit the proposed change. The notified body shall issue the supplement certificate based on the proposed changes audited. It is essential that the manufacturer has solid internal procedures to determine whether changes within the quality management system qualify as substantial, and therefore trigger the obligation to inform the notified body. This can be integrated into several operational areas. Change control procedures may include criteria for assessing whether a change affects certificate content. Decision tools such as checklists, developed by the manufacturers based on Annex 12 elements, may be utilized to systematically verify whether a change touches upon certificate content. For example, change of authorized representative, any conditions or limitations listed, or a critical supplier. The notified body plays a critical role in verifying that the manufacturer's quality management system can identify and managing substantial changes. During audits, the notified body should review the change control procedure, including how the manufacturer evaluates and documents the significance of changes. The notified body should ensure that the manufacturer is correctly applying the conformity assessment process, as approved, when determining whether a change must be notified. Critically, the notified body should Only review substantial changes as notified by the manufacturer. Refuse to accept routine or irrelevant change notifications that are not substantial. This reinforces the principle that only meaningful changes to the certificate require a supplement. By focusing audits on this decision-making capability, the notified body helps maintain a system that is both efficient and compliant, without unnecessary oversight or administrative burden. As a final conclusion, the MDR and IVDR are strict enough. Let's stick to the minimum requirements. There is no need to exceed what is required. Let us adhere to the minimum necessary obligations, faithfully, consistently, and without excess. This ensures both regulatory compliance and practical feasibility for manufacturers without undermining patient safety or product quality. We welcome your thoughts. Please leave comments below. Ludger Moeller brings nearly 30 years of regulatory experience to the field of medical devices. He previously served as a lead auditor and device expert for active medical devices at a notified body. Currently a CEO of MDSS GmbH, he remains in close contact with clients and their compliance challenges. MDSS entities provide representative services in accordance with country-specific requirements for medical devices and related regulations. We currently represent manufacturers in the EU, UK, Switzerland, USA, and Australia. Our services may also cover compliance with additional regulatory frameworks, such as ROHs, GPSR, GDPR, and others. In addition to our role as authorized representative, we may act as the legal representative or sponsor for clinical investigations. From clinical to post-market, MDSS Consulting, GmbH, and MDSS USA Inc. supports comprehensive lifecycle compliance strategies. We assist our clients in developing robust, customized compliance approaches tailored to their products and markets. MDSS also offers seminars, in-house training sessions, and workshops, each tailored to the specific needs of our clients. Artificial intelligence has been used solely for editorial support. An avatar has been included to enhance the viewing experience. The content of this presentation has been carefully prepared to provide insight into regulatory requirements, supported by illustrative examples. These examples are intended to clarify specific issues but may not be applicable to all devices or individual compliance situations. While selected elements of the regulations are quoted, they may be abbreviated or adapted for illustrative purposes. Since the focus is on outlining the minimum requirements, others may hold different interpretations. In fact, varying interpretations are to be expected, and in some cases they may extend beyond what is required. Ultimately, only the official texts of the regulations constitute the valid source for determining the appropriate compliance path for any product. The MDR and IVDR are strict enough. Let's stick to the minimum. If you have any questions or would like to get in touch, please use the contact information provided on this slide. Thank you for your time. We look forward to seeing you soon.